Okay, hello everyone. This is Ray Langlois, and I'm the WilCo Wellness Alliance Coalition Coordinator. And welcome to our Maternal and Infant Health Mid-Year update of the WilCo Wellness Alliance and our Community Health Improvement Plan. I'm also here with Melissa Tung, who is the lead on the Community Health Improvement Plan, as well as a systems analyst for the WilCo, the Williamson County and Cities Health District. We are recording today, and that way we can put this on our site, the www.healthywilliamsoncounty.org website, and then we'll also have a place that we can, a part that we can do live responses, as well as you're welcome to type in questions as we go along. So our objective today is just to go through a little bit of what we've covered over the last 6 months with the Alliance through our 3 meetings, and we'll cover the top 5 health priorities and do a recap of those mid-year, our 6 months progress update for the Alliance, our Community Health Improvement CHIP update, a brief discussion, and then also tell you a little bit about what we see as the next steps. Just going back through our top 5 health priorities, these were established through the 2016 Community Health Assessment conducted by the WCCHD. And those priorities were established through several groups, as focus groups, as well as community surveys. So those were mental health, access to health care, awareness of health care resources, active living, and chronic disease. And throughout this year, when we've been meeting in our working groups, and when we developed the Community Health Improvement Plan, the CHIP, one of the first things we did was an alignment between the 5 health priorities and the working groups that were targeting those health priorities as part of the interventions. And so see on this chart here that maternal and infant health, we're working in the areas of access to health care, as well as chronic disease. And then we wanted to give you some information about how the Alliance and the Maternal and Health Infant Group is progressing over the last 6 months. So just overall, the membership of the Alliance has increased almost 100-fold since January. We're very proud of that. It's a 20% increase, and it has approximately 170 organizations represented throughout the Alliance. A breakdown of the membership, you can see where maternal and infant health has 70 members, and is all the membership of the 600 plus members is pretty much proportionally balanced throughout the groups. And the working group participation, we've had really great meetings. We've had 3 meetings so far since January, and we've had really great meetings. Maternal and infant health, one of the stronger groups, averages around 12 people in participation. We do have a goal of 25% of the members participating in the working group, and we're about 7 members off of that goal. We are excited, though, that the 82 members that currently regularly attend our working group meetings represent 45 organizations throughout the county and Central Texas area. We've had several highlights this year that we're we're really excited about from the Alliance. And one of our commitments is not only to network, but it's also to learn. We've had 23 presentations presented in our working group meetings or at our summit that was held in April. Speaking of the summit in April, we had over 102 members attend that summit, as well as 60 organizations represented. Our support staff also attends meetings outside of the Alliance. Many of those are in Austin or around the surrounding communities in Williamson County, and we are members of 8 additional coalitions ourselves. Our support staff also has presented and trained over 330 community members on various topics such as our website, the child ship, tobacco referral system, and the WilCo Wellness Alliance. Another one of our highlights that we're very proud of is the establishment of the West WilCo Community Resource Coalition. There was a noticeable absence of an organized group in the western part of Williamson County, which includes Liberty Hill, Leander, and Cedar Park. And since the inauguration of this group in March, we've had 29 local agencies and about 54 members joined that group. They meet monthly. We've taken a little time off this summer, but they should start regularly scheduled meetings in September.
So for the website, we've begun to promote the website and a lot more in the past 6 months. And as you can see on the left-hand side, it's the how many users use the website, as well as on the right-hand side is how many page views. And so the blue line is in 2016 and the green line is 2017. So you see that our page views has drastically increased compared to 2016. There's been about 2,500 users in the past 6 months and over 11,000 page views. As well as, thanks to our vendor, half of our indicators have been updated in the past 6 months. That means our data is current and up to date. When we look at Aunt Bertha, the way we've been promoting how to search community resources, in the past 6 months, the top searches has been health, then housing, then food. Over 1,200 users made over 6,000 searches, and that's about 200 users per month searching for community resources. And that's also approximately 4 searches per user in the past 6 months. And so in early June, the Alliance sent out a survey to really understand the progress we've been making. In the past 6 months, we believe that it's important that we get member feedback, as well as we understand that a lot of progress and a lot of community health initiatives are done outside of the working groups, and so we really wanted to capture that and present that for the whole Alliance to y'all today. And so I'll just go through briefly over some of the survey results. And so about 48 members filled out the survey. And so half of that, 25 of them, are actually new to the coalition. And then the rest ranges from 2 to more than 5 years as members of the coalition. So you can see there's a broad range of respondents. We've begun many of our community health improvement goals this identified through the CHIP planning process was related to collaboration and networking and increasing awareness of working group member activities. And so we really wanted to capture that and to see how many connections our members have been making. And so as you can see from left to right, there were about 7 members that said that they weren't able to make connections, and a majority of that was either because they were a new individual or they would like more active networking, which is what we've begun to do more through our working group meetings. 27 members, that's half of survey respondents, that they've made between 1 to 3 connections with new organizations. 9 said 4 to 6 connections. 2 said 7 to 9 connections, and 3 individuals said they've made more than 10 connections with other organizations. And that has actually led to over 36 new initiatives and partnerships throughout our alliance, which is really, really awesome. And so I'll just highlight a couple of these, and feel free to take a look, and we can even ask those organizations more information about their new initiatives and partnerships. I think a cool one for maternal infant health, the support. The interview said, the support I have received about medical admission at home has been wonderful, from school district contacts, Head Start, etc. I truly enjoy a group. And you can see there's a broad range of organizations: Brighter Days Food Pantry, Round Rock ISD Parent Group, Life Steps, Central Texas Food Bank. There's more that someone mentioned that they've discovered great prenatal resources through the March of Dimes, and they've been a great resource to the Maternal and Infant Health Working Group, especially at the last meeting, and they provide a lot of information about birth spacing or postpartum woman, or etc. And also, lastly, there's even more great partnerships from Catch My Breath e-cigarette program to Seton Group, American Health Association opportunities, who presented at last meeting, as well as WilCo EMS. And so we kind of wanted to know what some of the benefits of the website that our members have been partaking in. And so the top 3 were actually the community events calendar, which has really blossomed over the past 6 months. Many individuals have been posting their event pages, events onto the calendar, as well as you can actually embed that calendar onto your organization's website. Second is health and population data, and third is working group and community group information. We asked survey respondents to kind of rate the services that we provide so that we know how to continue to improve, or what's been really beneficial. And as you can see, number 1 is networking and collaboration, 2 is learning about our agencies and organizations, and 3 is the community health improvement process, which are 3 things that we've actually begun to focus more on through our working group meetings. Before we ask survey respondents to kind of rate where their membership support is for the Alliance, because we believe it's a partnership. We would love to continue to partner with our members. A majority, over 80%, said that they participate in our events, which is awesome. About a little bit more than 60% says they promote the Alliance, and then more than 60% said they provide community resources. We asked continued survey respondents how they can continue to support the Alliance. And the top 3 is continue to promote the healthywilliamsoncounty.org, participate in the CHON-ship process, and promote the Alliance through presentation. And so that's really awesome to see our members wanting to contribute more to the Alliance. And lastly, we had asked this in the last survey also, when we kind of wanted to evaluate the CHIP action planning process, and continue ways for the alliances to improve is for us to continue to support and promote member activities, events, and outreach efforts. 2, to increase networking opportunities, and 3, to seek funding to support working group activities.
So we're very proud of the work you guys have been doing, and we thank you for your feedback on how we can continue to improve the processes of your working group in the Alliance. Now we want to talk about the Community Health Improvement Plan and update you basically on the entire plan and then your portion of it. So let's just look overall. All the working groups are working on various initiatives within the plan. Our Board of Health approved this plan in January, and 6 months later, we're really proud that we have started 64% of the strategies. in progress of our total. And that's just a great start. When you think about, we have a 3-year goal to accomplish this plan in order to improve health outcomes for our communities in our county. And we've already got 64% of it underway. Tells us that you guys wrote a really good plan, and there's a high commitment to do this. Maternal and infant health has really done well. You have 8 strategies in progress, and you have 3 strategies that haven't started yet, but Melissa's going to go into a little detail on that to let you know what exactly you guys have been working on.
Great. So I'm just going to go just briefly over just the action plan and the progress that we've made through working groups or through member activities. And so just to remind you all, the goal for the working group is to improve the health and well-being of mothers, infants, and children by addressing health and wellness before, during, and after pregnancy. And all the objectives and strategies today that we talk about through the action plan is to really reach that goal and to really improve our community. So the first objective that we identified was continuity care. By 2019, the Maternal and Infant Health Working Group will encourage all maternal, infant, and child health initiatives in Williamson County to use evidence-based guidelines to align messaging used for education. Strategies include identify resources, building working group knowledge of Aunt Bertha, identifying sources of information, and aligning messaging. And through our working group and through our just the total alliance, we've really begun to push Aunt Bertha, and many of y'all have begun to use Aunt Bertha in the community and to refer individuals to resources. For identifying sources of information, I think everyone we've begun to discuss what are some reliable sources of information and where to find that, either through our website for data or for promising practicing to March of Dimes for prenatal resources. For aligning breastfeeding messaging, we through the action planning process, many have talked about developing a directory and a listing for resources, as well as maybe even creating a flyer so that we can begin to align our messaging with the members for the working group, as well as what messaging you want to promote in the community. The second objective is access to health care. By 2019, Maternal and Infant Health Working Group will improve access to health care before, during, and after pregnancy for WilCo women by identifying and sharing best practices. We've begun to discuss how to identify data to identify women in need and needs of target population. We kind of talked about certain areas that we would target women, such as women school age or teenage pregnancies, or women suffering from postpartum depression, to low-income families. And many have brought those topics to the working group. We need to continue to begin to identify the needs of the organizations in the working group, and how can y'all begin to promote each other's services, or identify resources or points of contact. We need to continue to, sort of similar to the breastfeeding messaging, begin to identify resources and best practice in Williamson County. At last meeting, Ray talked about promising practices on our website, which is another great resource for sharing resources and best practices in the county. Lastly, collaboration. By 2019, the Maternal and Infant Health Working Group will create solid relationship with organizations that provide maternal, infant, and child health resources in the county. And we really blossomed at this objective in the past 6 months. Actually, compared to October 2016, we've increased our membership of the working group, as well as we've conducted many networking activities in the working groups, as well as really focused on member announcements. We've had a large range of organizations that attend our working group, from Merchandise, Texas Mother Friendly, Texas State University, WIC, Opportunities, Williamson, Burnett County, Village Sky and White, St. David's, a large range of information and great points of contact. As well, we've begun to build working group knowledge of member organizations in the group. We've had Delfina Rodriguez from Maximus, who presented on Star Plus, Star Kids at our second meeting. She provided an overview of Medicaid, Texas Health Vets, and Managed Care, and as well as Becky Elam from Opportunities, who presented on Head Start, Family Case Management, and just the comprehensive services that they provide, and they can provide to working group members as well.
So, wow, congratulations, and I really do appreciate Melissa for supporting that group. It makes it easier for us that we have our support staff aligned with each one of our working groups so that they can focus in on the objectives and the goals that are going on in those groups. I didn't know, but this time would be a good time if you guys had any questions or thoughts. You can type them in, or if, let's see, I think some of you guys are up on your phone. And if not, what we'll do is allow you guys just to go ahead and email us. You'll have a copy of our emails at the end. You guys can tell us if you have some thoughts or ideas. We're real excited. We know that this is a long process, but we're just very proud of how well this group's done getting 8 initiatives started of the 11 initiatives that you guys wanted to take on. We do see some opportunities for some next steps, and so we want to be able to show you guys what that looks like kind of in our mind. We have several things that we'd like to do, and that's to continue. One is to continue to promote the use of community resources. Aunt Bertha is our zip code-based community resource tracker that we use through Williamson County. We've had a lot of great luck in our libraries, as well as using this potentially with our housing authority to promote this. We've had some training with our program navigators here at the health district to use this community resource, and we find it as not only a way to help clients, but the inter-referral opportunities. Community calendar has just been a plus this year, and I would encourage you to go and look at calendar on our website and post to it. One of the things that we really want to promote is the area of promise and practice, and then funding. Under the tools and resource part of our website, we have the ability to help you guys look for evidence-based and just good practices, as well as opportunities to find funding for your programs. And so we certainly want to be out there helping you guys do those things. Also, another thing that we would like to do in the next 6 months is to update our performance measures. So we talked a little bit about starting these initiatives, but we need to know, are we making a difference in these strategies? So we're going to work on updating those performance measures and bring that back to you and have that as part of the discussion as we do our kickoff meetings in September. Another thing we'd like to look at for next steps over the next 6 months is creating a plan to improve member engagement in the meetings, webinars, and such. We're looking at not only technology as an enhancement, but ways that we can keep you guys engaged in meeting your needs as well as fulfilling the obligations that we're trying to meet with the community health improvement plan. So if you have ideas in that area, I know a lot of you attend different kinds of meetings all over, and please send us your emails and let us know what those strategies are. And then lastly, just to focus on moving all the CHIP strategies from not started to in progress, I think the Maternal and Infant Health Group had 3 strategies that they could focus on moving to in progress. And we're going to go ahead and spend a little time addressing those as well. Just to let you know, we are coming up. This will kind of take care of our July meeting. We're all off in August from our meeting schedule. But then come September, be on the lookout for a kickoff meeting, kind of kicking off the next 6 months, really celebrating but understanding the work that's ahead of us with the Maternal and Infant Health Group. Just let you know, we've had a change in our emails, so here's the emails that we have listed. This also gives you an idea of who our support staff, Kelly and Amanda, as well as Melissa, all focus in on various working groups, as well as me, do the same thing. So I think, does anyone have a question or any comments? See, we do have one question type, so we're going to look at that real quick. It's from Becky. She says she just wanted to throw out there that they're in need of applicants for prenatal moms for upcoming school year. Ideally, she would like to serve moms who are due in December and January, but they're going to take any applications. She'll send out a flyer for their prenatal services for you to help promote her program. And that sounds great. And that thank you, Becky, for doing that. That's always important that we do the member announcements as part of our partnership and our networking opportunities. So thanks for using that. Okay, so if we don't have any more discussion, we're going to go ahead and post this out for all the members of the Maternal and Infant Health Group. It'll be on our website at healthywilliamsoncounty.org, and we appreciate you guys being with us for our